I'm oral historian Mike Chappell. Today, June 19th, 2010, I'm interviewing Dr. Jean Wilson for the Endocrine Society at its annual meeting being held this year at the San Diego Convention Center.
When I was given the opportunity to set up my own laboratory, I knew that I wanted to work on hormone action. From the reading I'd done and the work I'd done in Selden's lab originally and the reading, I was convinced that nothing was known seriously about how hormones act. They had only been described 50 years beforehand. Endocrinology was only about 50 years old then, but all the focus up to the time I entered it was on either syndromes of hormone excess or hormone deficiency. And I knew I wanted to do something in it. And when I was a senior medical student, I attended one of Selden's research conferences in which a patient with hypocalcemia was presented. And in the differential diagnosis, he discussed the possibility that the patient might have pseudohypoparathyroidism, which was the first syndrome described in which hormones were made normally, the normal amount, but you couldn't respond to the normal amount because there was something missing in peripheral cells, so that there was something missing that the hormone didn't work. It was the first hormone resistant state. And I immediately realized intuitively that hormone resistant states would be a good way to study hormone action. So that I kept that in my mind for 15 years. So I wrote a grant request to study the effect of testosterone on protein synthesis and RNA synthesis in the male urogenital tract. And it was funded just as I got out of the NIH. And I had, but so far as I know, it was the first grant ever written on hormone action. And within 6 months, I demonstrated that administering testosterone to a castrated male rat causes a doubling of protein synthesis in the seminal vesicles of the in the male urogenital tract. Fortunately, the laboratory was joined by my first postdoctoral fellow, Nicholas Brukovsky, who was an MD PhD from the University of Toronto. And within a couple of months, using the system that John Chatfield had developed, he was able to, using a combination of urea and salt extraction of the nucleus, he was able to get a suspension that you could chromatograph on Cephadex's gel filtration, gel exclusion chromatography, and was able to show that about 40% of the hormone in the nucleus was bound to a specific fraction, which he then was able to show was a protein. And what he found was that the majority of steroid that was attached to the nucleus was not testosterone, but rather was the 5-alpha reduced derivative of testosterone, dihydrotestosterone. And that observation changed our approach to everything, because first of all, that 5-alpha reduced steroids had been known in the literature for 40 years at least. It was the first androgen ever purified from human male urine was androsterone, which is a 5-alpha reduced steroid. And it was known that if you inject it into castrated rats, it's an active steroid. But after it was discovered that it was not that androsterone was not the circulating steroid, that testosterone was the testicular and circulating steroid, 5-alpha reduced steroids had gone to the back burner, and they were thought to be degradation products. But the fact that we could demonstrate dihydrotestosterone at the site of action of the hormone meant that we had to re-examine all of androgen physiology. We and a lot of other people had to re-examine androgen physiology to figure out what part of the action of testosterone was due to testosterone itself and what part of action was due to its metabolite, dihydrotestosterone. I'm very optimistic about the future of endocrinology for several reasons, and one is that we have all of these orphan receptors and orphan mediators available that they can best be examined using the frame of endocrinology. In my opinion, that is very likely that that they're going to feed questions that endocrinologists can answer for a long time. Second, new endocrine syndromes continue to be resolved, continue to be described, and these can only be described by endocrinologists. And the third is that endocrinologists are very well set up to do whole systems physiology. The basis of endocrinology was the feedback loops and the control of the pituitary and so forth, and endocrinologists are trained in that way, and I think it's been predicted by many people that endocrinology is perfectly posed to lead a renaissance in whole animal and whole organ physiology.